Good evening, everyone, and welcome to tonight's webinar or lecture this evening. If I'm not mistaken, this is the last webinar that we hosting for 2019 on the consumable webinar side. And I would like to take this opportunity to thank each of you for joining week after week and sharing your evenings with us. And then also for your support, continuous support during 2019, and allowing Wright Milners to be your partners in your dental surgeries. So the objective of tonight's lecture is to give the nuts and bolts of dental cementation and products. We often get asked as sales representatives what cement to use with what crown materials or kind of materials. And I believe there isn't one size fits all when it comes to cementation. So I'm very pleased to invite and introduce Dr. Andrew Osafo tonight. Dr. Andrew graduated from BDS and the London School of Medicine and Dentistry in 2003 and works in primary and secondary care. He has special interest in minimal invasive dentistry, facial aesthetics, pain-free dentistry, orthodontics. Dr. Andrew also enjoys writing articles, and he enjoys and he is current, he tests numerous products for different companies, and his passion is health and aesthetics. Dr. Andrew is passionate also about fundraising and has taken part in a number of marathons and events of charity. In 2019, Dr. Andrew received the International Academy for Dental Facial Aesthetic Fellowship. This fellowship is by invitation to those members of the dental industry who has distinguished themselves in their respective professions. So Dr. Andrew, please join us on stage. Just waiting for Dr. Andrew to join.
Hello.
There you go, Doc. Welcome to the South African audience.
Thank you for having me this evening.
Our pleasure. Okay.
Can I start the presentation?
Yes, you can share your screen. I'm just going to wait and see if all is okay, and then you can start.
We had some issues earlier, but hopefully.
Yes.
Resolve themselves. Right, can you see?
Yes, 100%.
Excellent. So good evening all, and thank you very much for having me this evening. The theme of this presentation is keep up to date with dental products to provide better care. And when a dental company or representative contacts you, how do you react to what they have to say? Do you try to run to the hills or try and hide from them to avoid having any contact with them? Or do you make the time to listen to them? As clinicians, we're very busy, and I appreciate you giving up your time. I believe it's 7 o'clock in South Africa. It's 5 p.m. here in the UK to listen to this presentation. And because we are juggling so many balls, we have so many pressures, if we're not careful, we could get into the habit of doing what we always do when it comes to dentistry, things that work well in our hands. We could get into a comfort zone. We could hesitate to try new products or new procedures. Does that describe you? The following slide lists 3 reasons why people have a barrier to change. Does that describe you? You don't know, you can't do, or won't change. I'm very passionate about minimally invasive dentistry. And we know that as time goes on, products develop and new procedures come aboard. But this paper by Professor Innes looked at barriers to moving knowledge to action. And this paper was looking at managing caries, the chemical interactions of using agents to remove decay, rather than the conventional blacks cavities, try and remove as much as possible. But what does this mean? Don't know. It could mean that although we have the abundance of evidence and lots of materials and so on, we just don't know about them because we're so busy in our offices. We've had COVID, no doubt. I'm talking about the UK. We have a big demand for treatments. And because of this, we may just have tunnel vision. We may just say that we just need to get on to the next patient. And because of this, we may be missing advances in dentistry. Another thing is that we can't do. We lack the confidence to change. We lack the confidence to try out new materials, to assess different products. And the final one, which is probably the most dangerous, is won't change. And such an individual is in a comfort zone. They don't want to change. And that is a very dangerous perspective to be in, because if we're still practicing the same dentistry that we learned when we were taught in dental school, we're really not doing the best for our patients. We're doing a disservice to ourselves and also our patients. So the purpose of this presentation is to ask ourselves, are we informed clinicians? What does it mean to be an informed clinician? Well, someone that is informed is able to appraise information, takes the effort to consider it, and then makes a learned decision. It takes time, it takes effort. This evening, you've given up some of your time to be here, and I promise I won't be more than an hour because you have families to go to. But what are the benefits of taking the effort to become informed? Well, and keeping up to date. Well, it can be described very nicely in the following two quotes, which is from a paper that I would recommend you to look at. It's from the Dental Products Report, Breaking Out of a Restorative Rut. And this is what Nick Cipriano said, who was an MBA global manager of restorative procedures. He said that materials continue to progress, and with them they come new techniques. And if we don't adopt these techniques, we could be missing out on efficiencies and opportunities to make our practices more profitable. Another benefit of making the time to keep up to date and learning procedures is summed up by Dr. Lawson. And isn't it true, when we learn something new, not just talking about dentistry, how does it make us feel? Don't we feel better? But particularly with dentistry, if we're not careful, it can become quite mundane, seeing the same patients year in, year out. But when we learn something new, a new procedure, a new technique, a new product, what effect does it have on us? Well, as Dr. Lawson says, it reinvigorates us. It makes us a better dentist, and it also makes us more productive. And we become excited about doing dentistry again. Change is good. So for the rest of this evening, we're going to be looking at cements, and in particular, luting cements, because there's different, this term can be used quite confusingly, cements. But when we're talking about a luting cement, what is its objective? What's the purpose of it? Well, a luting cement forms a link between a fixed restoration and supporting tooth and the tooth structure. And there's two objectives with a luting cement. It keeps the restoration in place for an indefinite period of time, but it also prevents a micro leakage between the material, the cement material, and also the tooth structure. And luting cements out of dental, I have an interest in dental materials, and I promise you, you're not going to be tested, or you're not going to have the chemical breakdowns of the various things. This will just be an overview. But if we have to recognize that as a dental material, luting cements have one of the most demanding requirements of all dental materials. Why is that? Well, dental luting cements must set in the mouth and change from a fluid state to a hard state. And that process has to take place in minutes. And it has to be biocompatible. So what are some ideal properties of luting cements? These are some of the ideal features of a luting cement. It must have low film thickness, because if it doesn't have a low film thickness, it could prevent the seating of the restoration of the crown. The patient will be very happy about that. It also has to be easily handled. It has to be biocompatible. It shouldn't irritate the tissues. And it also must provide a lasting seal and also achieve adequate adhesion. So this is the wish list of luting cements. But unfortunately, no current dental cement is excellent in all of these areas. So what does this mean? It means as a clinician, we need to judge what luting cement is best for each occasion. And we also have to understand the principles behind using various tools. And by doing this, we benefit the patients and also ourselves. And we shouldn't also think that because a luting cement is very good at sticking our restoration in place, that it negates us from doing a diligent job in doing a good preparation. It's essential, if we're going to get a lasting result, that we take the time to do a good preparation, follow the procedures of a good preparation, and also focus on our impression, because we want our margins to be super gingival. And then if we do our part, the available cements can help us. So what cements are there available? Well, cements are divided in various categories, and for this presentation, we've broken them down into traditional and resin cements. Traditional cements include zinc phosphate, zinc polycarboxylate, glass ionomers, resin modified glass ionomers, self-adhesive, and various resins. And the next slide shows the chronology of the developments of luting agents. We're focused today on definitive or permanent cements, but the very first cement was developed for dentistry or used in dentistry was zinc oxide used in the 1850s. The first definitive cement was zinc phosphate. And then we can see from 1880 all the way up to 2014, the development. Zinc polycarboxylate, glass ionomers cements were developed and used from 1972. And then the latest iteration of cements is the self-adhesive resin cements. So let's look at the first cement that we can look at. And this paper here, the proper selection of contemporary dental cements, I'll encourage you to look at this. And if you do want any of the references for this presentation, my email's at the end. Please pop me an email or contact Tanya, and she can give you the information if you so require. So the very first cement that we're going to talk about is the oldest, zinc phosphate cement. Unfortunately, with this platform, I can't get your interaction. So is this the only cement that we have in our cupboards? It's very cost effective. And the next slide shows the main features of such a cement. And this is really the gold standard for all dental cements, because it's been available for over 100 years. It's got a long track record. It's got good compression. However, the downsides with this cement is got high solubility in the mouth, and it doesn't adhere to tooth substance. And one of the biggest reasons why this cement is not, although it is available, and there's been a move away from this, is because of the low pH that it produces on setting. And it also causes a high heat production during setting, which can cause pulpal injury, which wouldn't be happy for your patient. So because of the limitations of zinc phosphate cement, other cements have been produced. And the next one that was produced was zinc polycarboxylate. And when we were in dental school, we basically only used, well, we looked out, if we liked the patient, we would use two cements. Poly-F, we thought that this could stick everything, or Panavia, which we will discuss in a few moments. But what are the benefits of zinc polycarboxylate cement? Well, it was the first cement to actually bond to tooth structure. Zinc phosphate doesn't do this. It is just a filler. However, there are drawbacks with polycarboxylates. It has high viscosity, which we said is an issue, that luting cements need to be having thin film thickness. If not, it could distort the seating arrangement of a cement. It also has a very short working time, and to counteract that, you use a cold slab, but it also has solubility issues. And as we said, a cement should be insoluble, so it's impervious to attack. So we're now going to move on to another cement that has been produced, and it's something that I use quite a lot in my dentistry. Glass ionomer. And glass ionomer is an excellent product. We know that it's in dentistry, it can be used as a liner, a base, but we're looking at it as a cement. What are some of the benefits of glass ionomer cements? Well, we see that it's a water-based cement, and it also causes adhesion. And one of the benefits with the setting reaction is that it causes fluoride release and recharge. However, we have to recognize with glass ionomer cements that they are sensitive to moisture and dehydration. And because of that, they need to be protected. And it needs time to fully set. We shouldn't be trying to clear off all of the cement, because we could distort the cement while it is setting. So patience is key. So glass ionomer cements are excellent. However, because of their limitations, another cement was produced. And this is some of the indications of glass ionomer cements that can be used for metal restoration, cementations, stainless steel crowns, and also posts and screws. There are some contraindications with glass ionomer cements, specifically all ceramic restorations, because you get something called hygroscopic expansion, which could affect the long-term aspects of and longevity of a restoration. So resin modified cements have been developed, and the reason for these cements is that they combine the beneficial properties that glass ionomer cements have, i.e. fluoride release. But they also increase retention by using various agents. And these materials are, in comparison to glass ionomer cements, produce a higher strength, compressive strength and tensile strength. And also they have a low solubility in water, solubility of resins, which reduces the chance of distortion when it comes to seating. So as we said, that the composite resin is incorporated in this product, and it's substituted with glass ionomer particles. It's a hybrid. We have increased strength, low solubility, which is a positive thing, and also it has fluoride release. It sets very quickly. Now, with the advent of technologies, adhesive dentistry has been a game changer. And as I said, when we were in dental school, the go-to cements were either Poly-F or Panavia, and there was a battle to try and get Panavia. But what are some of the benefits of adhesive cements? Well, these are very good for aesthetic. You get chemical bonding, and because of the bonding strengths, you get the highest bond strength with this. It has very low solubility. But with the first generation adhesive cements, they are technically sensitive. A number of steps are needed to get a maximum benefit. And moisture control is so important, because if a tooth gets wet, you have a problem. And it's often very hard to clean up after you've done such cementation. So a tack cure is often recommended. And this brings us on to the latest iteration of cements, which is the self-adhesive cements. And as we said, that these came into the market in 2004. And no, speaking from experience, these are very common cements, and they're well used, especially when it comes to ceramic dentistry. So we have examples here of Reliance Unicem. We have Ivoclar has SpeedSem. Kerr has MaxiSem. We're seeing a pattern here. And SDI changes up a little bit. They have SET, which is a self-etching adhesive. So what are the benefits of self-adhesive cements? As we said, that these have grown increasing acceptance. Why? Because they produce a chemical bond to tooth structure. And because they are self-adhesing or self-etching, you don't need a separate etch and a prime. There's no phosphoric acid. There's no special primer needed. They're dual cured. They can also be light cured. But it's very important that we don't use such a restoration if there's insufficient retention. And some are fluoride releasing, and they're less technically sensitive as compared to conventional cements. Now, there has been something called aesthetic cements, and we have various ones that can be used. And these are very high strength, but again, they are technically sensitive and are very good for veneer cases and so on. When it comes to a cement, we need to not go to the stopgap that we know we're going to only use one cement. As we said, we need to consider each case. Consider the tooth. What's the preparation design like? What's the mechanical forces? And then decide what's the best cement for that particular occasion. For example, if it's a low strength material, it needs to be reinforced. So an adhesive cement is recommended. If it's a high strength material, it doesn't require strength from the cement. So therefore, self-adhesive cements are commonly used. And as we said, the adhesive cements have greatest bond strength. And the next slide just goes through some of the advantages, disadvantages, indications, and contraindications of various cements. As we've said with glass ionomers, they produced high fluoride release. They're adhesive in wet conditions. So in cases where it's difficult to get a very good seal, glass ionomers are very good. The disadvantages though with glass ionomers are that they are sensitive, and they need to be, they're moisture sensitive, so they need to be protected. Indications for use of these are metal ceramics, zirconia crowns. Contraindications are all ceramic restorations, because of as they set, they expand, and as a result they could damage the nice pretty emacs that you have done. So they're contraindicated in such cases. What about aesthetic resins? Well, these have the highest bond strength of all cements that are available. They're as the term implies, they're highly aesthetic. However, they're the most technically sensitive. A number of steps are needed to ensure that you get the good result. And because there are a number of steps, it's quite easy. I don't know when it comes to you, if you are, when you have a DIY job to do. My wife doesn't like me doing DIY, although I try my best. Are you an individual that when you have a job to do you actually look at the manual to see each steps, or do you just try and wing it? Do you try and just think that, I don't need to follow the manual? The danger if you do this, and if you use aesthetic resins, each step is essential to follow. So if you do not follow the step, it compromises the final result. And as we said, finally, self-adhesive resins, you don't need to etch, you don't need to prime. They are less technically sensitive. We still have to be careful when we're using these agents, but they are less technically sensitive and they're easier to clean. And the indications, and it has a wide gamut because they are self-etching. They could be used in all ceramic crowns. They can be used in onlays, inlays, bridges, metal and ceramic work. And the contraindications are veneer cases, which you would use an aesthetic resin cement. So what we're going to do now for the remaining of the presentation, hopefully you're still with me and you haven't fallen asleep. I did promise that we weren't going to go into the deep chemistry. I'm going to talk about two products that I'm very impressed with and why. So the first one is Revoluting Cement, and the second product is Set, and both of these products are produced by SDI. So let's talk about Revoluting Plus. Are you using it? Do you know about it? Now, this has been on the market for a while. And what are some of the benefits of Revoluting Plus, which is a resin modified glass ionomer? So we said that it has additional benefits to a conventional glass ionomer cement. SDI produces conventional glass ionomer called Revoluting. So what's the plus bit? Why should we be interested in this? Well, it's a self-curing restoration. It adheres to the tooth and substrates. And one of the very good things that I really like this product is BPA free. A lot of patients are trying to are very curious and careful about what is being put into their body. So this is a very good point to let your patients know that this is BPA free. People are avoiding using various bottles and so forth. And with SDI products, it has something called iron glass technology, which the end result is that there's a higher fluoride releasing and a recharging ability. So it releases fluoride, but it also absorbs fluoride as and when we brush our teeth. So it causes remineralization and it's a protective effect. It also has high flexural strength, and this means that there is reduced cracking and failures in flexion. It's got a high acid resistance because we know that the mouth is a very difficult environment, as we said before, that out of dental materials, luting cements have the most demanding job because with the acid, it could break down the cement, and if that happens, you get a gap and therefore micro leakage, which is a problem. It also has high bond strength, not as high as we said as the resin cements, the true conventional resin cements, but because it has resin particles and resin properties, it has high bond strength. So what are some of the indications of Revoluting Plus? Well, it can be used in a wide range of restorations: resin, metal, porcelain fused, inlays, onlays, bridges, and also crowns. And it also can be used for the cementation of pins, post-in cores, and reinforced ceramic crowns. And it's also very good if we are working, a moisture control is an issue. These are much more forgiving products than, say, a resin cement. The contraindications are pulp capping, and this product has a universal light yellow shade. But as we said, when we are using a product, it's important to take the time to actually read the instructions. And because by doing that, it helps us to see the necessary steps to get the best result. So the next slide will look at some of the steps that they have. And these are very important. This is, and do we do these steps, or are we trying to get the restoration done as quickly as possible because we've got a patient waiting? We must really take the time to do these steps. So what's the first step? We need to isolate and prepare the tooth, apply a conditioning agent to help, or etch the tooth to help remove the smear layer, and then wash and dry. This is a very important step. And often, and that also goes for glass ionomers as well. It's a very important step to increase the adhesion. We want to remove the smear layer. And then once we've done that first step, we then need to ensure that the internal surface of the crown, or the indirect restoration that we're going to use, is fully cleaned. We shouldn't just expect that, the work has come back from the lab and it will fit. But we need to check inside, has any of the cast broken off before trying it in the mouth. And then we need to activate it. Now, with the glass ionomers, a lot of the companies produce the powdered liquid version, or as shown in this image 3, they also have the capsular type. And you've got to be very careful. If you choose the powder liquid solution, well, number one, your nurses may not be happy with it, rather than using Automix. But it's very important that you follow the prescribed regime by the manufacturer, because if you do not use the recommended quantities, it will have an effect on the setting reaction. So for this reason, increasingly more practices are getting the auto-mixed solution, because you get the set quantities in place. So once you've mixed it, and there is an applicator that you use, and then you need to gently extrude the material, approximately 1 millimeter of cement, onto the bonding surface. Then seat the restoration within 30 seconds. This is a fast setting reaction. But once you've seated the restoration, you've got to wait, because as we said, if we quickly adjust a restoration, a cement-like glass ionomer, we could affect its long-term properties. So when it's in a gel form state, which is approximately 2 minutes from the start of mix, then start to remove the excess. Don't do it straight away. It needs to harden sufficiently. And then this is very important, that when we have set it, it needs to set under pressure. So I always, when I'm using a cement, put it in position, get the patient to bite down so it's fully seated, and then let them bite on it. The worst thing is if you've done a lovely piece of work and then the patient contacts you a week later and they're not happy because of the seating. And so what do you have to do if it's not fully seated? You need to keep on adjusting your lovely work, especially if it's a metal, porcelain fused to metal. What happens? You keep on removing the porcelain, and then you get down to metal. And often patients are not happy if they start seeing metal in their mouth. So it's extremely important to get the patients to bite down, to get it to set under pressure. So that was one product that I like. It's It's particularly excellent because of the iron glass technology. So you get higher in comparison to other glass or resin modified cements. Because it has this iron glass technology, you get a higher fluoride release, which protects the tooth substance. And this is a clinical case that shows the results. And can you see these images are kind of supplied by Jean Pierre, that this surgeon has waited for the glass ionomer to get hard, to get to the gel formation before removing it. So it's very important to set it under pressure and then give it time. Don't worry about trying to clear up straight away, because if you do, you could distort the final result. So again, I encourage you, although I'm speaking that I like it, I would encourage you to look at the evidence. Ask your reps for the evidence to see why resin modified glass ionomers are good to use. Now, the second product I'd like to talk about is SET or SET PP, and this is a self-etching cement. And as we said earlier on, the first product that came to market and has a lot of presence, actually, I'm talking about in the UK, I don't know, in South Africa, was Reliax Unisem, and I'm an associate in practice, and my principal would guard the Reliax Unisem under lock and key. We had to sneak in to try and get it. Why was that? Because of the cost, and we'll talk about that shortly. But with this SDI product, there are two formulations. The first iteration was SET, which comes in a capsule. The newer generation is SET PP, which is in a syringe, and it has the hardening and strengthening has improved. So it's a very, very good self-etching cement. With all self-etching cements, they chemically bond to tooth structure and core materials. One of the things that sets, I didn't mean to do that pun, but sets SET apart from other self-etching adhesives is that it's got extremely high fluoride release. It's also very radiopaque. It has a low film thickness. It's got no BPAs or HEMA, and it's dual cured. And unlike the self-etching cement like Reliax Unisem, which only comes in one shade, SET is available in a variety of shades. We have 5 shades there. And that's quite good if you're doing aesthetic work. So we're going to, again, encourage you, if you're using a product, and we're talking about cements, take the time to read the manufacturer's instructions. So we talked about the effect of the high fluoride release, and this was a paper done comparing the fluoride release of SET with other agents, and in this case it used Reliax Unisem, and when we can see that it has consistently high, comparing SET's fluoride release to Reliax Unisem, it's consistently higher. And we know that high fluoride release protects the patient's substructure, because it's terrible when a patient, and because unfortunately, if you're working on a patient, you've set it, and I don't know if you've had many cases, silent decay, it's just eating away, a crown looks lovely, and then all of a sudden it breaks. Why is that? It's getting weaker. There's a defect somewhere. But with fluoride release, it strengthens it, remineralizes it. So high fluoride release for any cement is very beneficial. Typically, self-etching cements don't have a high fluoride release, but with the SDI's product set, it does. So for me, that's a very big seller. And another reason, as I said, why I like it is the variety of shades. Talking about the UK, and we will have to ask Tanya about this, there is a very, very big difference in price between 3M Unisem Reliax and SET, SDI's product. It's about 30% cheaper, SET. And they have very similar properties. We know that 3M is a brand leader in many things, and because it was the first product, it's probably relying on a loyal base. But as I said, my principle has never changed from Reliance, but he has not looked at the evidence. Normally with products, the first generation is always improved upon. So what are some specific examples of instructions that are given by the manufacturer when it comes to using a self-etching cement set? Well, the first thing we need to do, and these images were kindly sent to me by Professor Monte Alto from Brazil. And really what we need to do, first of all, is take the time to remove the temporary cement and carry out prophylaxis. This is so important that we take the time to do this, to clean the tooth. We want a clean surface before checking the fit of the restoration. And if we miss this very first step, which is a key step, if it's not a clean surface or we've got some cement present, our restoration won't fit. And then what's the tendency? Dentists love using the drill. But if we keep on adjusting, what we'll be doing is we'll be affecting the fit of the crown. And long term, we will get a bigger margin, a bigger gap, and the cement will have to do more work. As we said, the key to long-term success for any cement is to have low film thickness and a thin layer rather than a thick layer so it doesn't break down. So once we've checked the fit of the crown or the indirect restoration, we need to remove any excess water. But it's important because we just said that it has adhesive properties, that we want to keep it moist. That's very important, that we keep this moist. And then if we're using the set PP, or we just want to treat the inner surface, if it's all ceramic, we'll have to follow the guidance to prepare the surface. And then once we've prepared the inner part of the cement or of the restoration, then we apply the cement. And be generous with this. As we said, it's considerably less. The cost is considerably less than Reliance Unisem. So be generous with it. Be generous with it. And then once because the worst thing you want to do with the cement is not apply enough in it. Because what will happen if you don't have enough cement, you're not going to get when you push it down onto the tooth, you're not going to get that nice puff. And it's always nice to see a lot coming out, because you know that when you set it under pressure, if you wait for the cleaning, you know that it's a very fine film. But if you're not sure, if you're using minuscule amounts, you don't see any excess cement coming out, you don't know if you've got a thin film. You don't know if you've got tooth adhesion. And once you've seated the restoration, it's important to wait. Again, wait 2 minutes for the initial chemical setting. And then once that's done, because we said it's a dual cured cement, then light cure. Light cure each surface for about 40 seconds with a high power light. So those are the steps. Now, hopefully, I've got a video again. This is a live case from Professor Monte Alto. It is in Portuguese. So let's see if we can play this. The volume when I did this, I'm going to talk through the steps here. So it's the in this case, Dr. Alto is working on the upper right 2, the upper lateral incisor, and also the upper right 3. So as this video, it's about 4 minutes. It is in Brazil. There's a lot of aesthetic work done, and on the Professor Alto does a lot of work looking at various cements. On that site, it has many cases that he's done. It's well worth looking at this to see the benefits of using a self-etching cement. So let's go through this process, right? So the upper right 2 has been prepared. The upper right 3 has had an implant. And so we've seen the recommended steps, but to see it live, this video is about 5 minutes, will help to see the benefits. And one of the things that the previous slide didn't show is the importance of good isolation. So in this case, rubber dam is used because we know that we want to get this. So that is the final result. But we're going to go through the steps that was taken. So rubber dam was used. So again, checking the restorations on the crown. Again, the tooth is thoroughly cleaned. The upper right center is thoroughly cleaned and pumice. Professor Alto is checking to ensure that there's no temporary cement has been removed and thoroughly cleaned. And washed. As we said, we want to keep our preparations moist. And we said one of the benefits of it's got 5 shades. So in this case, Professor Alto decided to use a 3, which is an opaque shade. We said with other cements available, for example, Relax Unicem, it only comes in 1 shade, which is translucent. So you can use it as an opaquer effect. So again, it's very important to do this first step. Always extrude the initial amount, and then be generous. Generously is prepared this ceramic restoration, and then coating it liberally with set PP, and then putting a position. And the same again with the upper right 2. Again, giving it time to do the initial setting. It's very easy at this stage to try, and you're waiting between 1.5 and 2 minutes for the initial setting. And then after you've done that, then remove the excess. You see it's like a gel state. It's gently removing that, giving it time, putting pressure on those areas as well. And then once the excess cement is removed, it's very important to check the palatal aspects, the hidden areas, because if that's left, it could cause irritation to the gingiva. So be very generous with time to clean off the excess cement. And then once the excess cement has been removed, floss. So important to floss thoroughly. Because it's self-etching, you didn't need to use the etch. And then, as we said, 40 seconds on each surface. And then clean up. So that was the final result. And we'll agree that the aesthetics is lovely. Patient all smiles. And we can see that because of the different shades, we can mimic this with set. And also, as we said, it's a very high fluoride releasing product. It's got very similar strengths to existing self-etching things, but what really sets apart is that it's got extremely high fluoride release in comparison to other self-etching cements. It's got a variety of shades, and it's much more cost effective. So will you be an informed clinician, or will you choose to continue to be stuck in a rut? We just briefly looked at some benefits of keeping up to date with techniques and procedures and looking at the evidence. And when we do this, I urge you, I encourage you, don't be afraid to get out of your comfort zone. Don't be afraid of dental representatives coming, dental companies coming. We know that, right? So kindly put on this webinar. Try out new things. Dental companies should be your friend. Ask them for the evidence for materials. Because if we take the time to learn about products and techniques, we will provide better care for our patients. Thank you very much. And that's my contact details.
Thank you very, very much, Dr. Andrew. Very informative. If there's any questions, I see Chantal answered one question already. Does SET and SET-PP have the same amount of fluoride release? Doc, I don't want, it's two different dispensing methods. Any feedback from you?
Well, I mean, it is, as we saw, in comparison to like Unison, SET, the original iteration, has consistently higher fluoride release. So you're going to get either whatever products you prefer to use, SET or SET-PP, you're going to get a very high fluoride release. There is different handling properties, but fluoride release is about the same. It's really about the strength, where SET-PP has improved on SET, but the fluoride release is the same. It's very high, which is unusual for a self-etching cement.
Perfect. And Doc, what cement do you prefer for your zirconia cementations?
So again, my go-to now is self-etching cement, because they work very well. But we know that in aesthetic cases, we saw by the cases done by Professor Alto, a self-etching cement was used. However, in aesthetic cases, sometimes you may want to go for the aesthetic cement. However, they are much more technically sensitive, and it's got a very high cost, the aesthetic cements. But generally, I'm using self-etching cements.
Self-etching cements. Okay. Any other questions? Let me just check this. Will the slides be made available? Had difficulty seeing from a mobile phone. Dr.
Yes,
Osman, I'll share that with you.
Yes, of course. Also, there's more clinical papers and cases. As I said, I believe sharing is caring. It's very important to be an informed individual. So I was kindly sent this information. I don't know if some of you there are lovers of dental materials. Hopefully I didn't go into too much. I didn't put you to sleep, but you can happily have the slides.
Perfect. Then I would just quickly, there's no more questions at the moment, so I just want to quickly share the promotions for this evening. Okay, so Dr. Andrew, can you see my screen?
I can't. I can see you.
Can you see me? Okay, wait, there we go.
Shared, is it?
There we go.
Okay, seeing it now.
Now,
okay,
you can see the specials.
Yeah.
Okay, so the set, the capsules, 2,500 for a box of 50, which is a very good price. The set PP, they are 2 in a pack, so they 2 7-gram syringes. So ultimately, you're getting 14 grams of cement for 1,950. And I think this is where the big price difference comes in if you compare the gram and the price, where other systems are either 8.5 or 11 gram, where this is 14 grams altogether. And then the Revoluting Plus, 50 caps in a box, 1,825 Rand, very good price. You also get it in the powder liquid, 1,650. We do still have some polar bears available. So if you order a powder liquid kit, you'll get a polar teddy bear with it. And then the Riva Sem at 895 Rand. So I know Dr. Andrew didn't talk about the Riva Sem, but correct me if I'm wrong, Doctor. Riva Sem is Revoluting Plus, but in a syringe.
Yes, it's just a different iteration of it. I mean, as I said, in the UK, there's a big price difference between 3M, Unisem, and Set PP. What is it in South Africa? Like, is that
it's about 40% if you do per gram price comparison. Yes.
Okay. So you're getting much more for your rand. Okay.
Yes. I just want to check the questions quickly. Can Silan Bond improve bond to zirconia crowns, and can we use an alcohol wipe to clean the tooth or the crown?
You can. I mean, although they are self-etching, I mean, you can silanating it, yes, and although you can do the traditional 3-step technique because you'll be removing the smear layer. Although they're self-etching, you could always bond the 2 substances as well. So yeah, again, if you are using a various product, always follow the manufacturer's instructions. Don't skip steps to save time.
Perfect. I think, let me go back to the questions. Is there any marginal color change using set cement? Some cements turn black at the margin.
Well, again, with this product, it's very important to, before you're doing any type of cementation, you want to get good gingival health. And it's important to try and keep your, as we said, we talked about cements. It doesn't negate the effects of doing good preparation design. So if you are concerned about issues with discoloration, maybe thinking about using a resin modified glass ionomer, because we know with any type of resin cement, you've got to get good gingival health because it will bleed into the restoration. Although the benefits were set that you've got different opacas or different shades to counteract that effect. But you want to have super gingival margins. You want to try, so I'm a big proponent of onlays. I'm also a big proponent of using dental lasers because you can modify the gingival heights or zeniths. And if necessary, you can actually, with a hard tissue laser, you can also affect the, you can remove hard tissue as well to maintain that biological width as well.
Then another question from Dr. Mutilal. Can silane improve the bond with zirconia with the Riva Luting Plus?
Yeah, I mean, if you have a lot of silane users, you've got to be careful with silane that it's in date, and also because it has a short working life. But if you're using a zirconia issue, you've got to, in all of the examples, you've got to prepare the surface. If you've got to etch the indirect restoration to get the best results. If you don't silanate, you're missing a trick. So I'd always say follow the instructions. Yeah, a good cement doesn't negate you or doesn't stop you following the manufacturer's recommendations.
Then Dr. Osman wants to know, is there ideal cement space for different cement types like the CAD-CAM?
Yeah, so again, a lot of users are using self-etching cements because with CAD-CAM technology, you can do minimally prepped designs. But again, you want to make sure, I think I'll definitely make that available to you, the advantages and disadvantages. Before I went into the two products that I like, it went through each cement and it gave the indications and contraindications. I think that would be beneficial. I don't know if I can share my screen on that now, or you can send it to anybody asking.
Perfect. You can share also if you would like.
Okay, let me just try and see if that's... Yeah. Let's go back to the slide. Right. Can you see the slides?
Yes, I can.
No, right. So this was it talks about the advantages and disadvantages. So as we said, adhesive cements, resins are very good for zirconia crowns. Yeah. Unlike the zirconia can be used. I mean, these cements can be used. They're very safe. They're very good to be used with.
And then, is there a specific space, like 1 mil or a cement space that's ideal?
Well, again, you want the thinner the better. I didn't, because I know everybody. I promise not to put you to sleep. Again, following the convention forms, you want a very thin layer. Perhaps what I will do is I will send some guidance on film thickness. But you really want a thin space, but following the prep designs of whatever preparation you're using. Yes.
Perfect. Thank you, Doctor. Then you can close your screen, and then we'll share the presentation with the delegates when we send out the CPD certificates.
Yeah.
And then thank you for your time. Thanks for spending the evening with us, and then thanks again to SDI for sponsoring the evening.
Thank you.
Thank you for attending, delegates, and have a good evening. Thank you. Bye.